But the biggest downside is your access. So Medicare pays the least amount of money for, for any, for every procedure. So if you have, uh, let's just say you go in for a doctor visit, whatever it may be, whatever procedure, whatever visit, whatever, every health system and every physician contracts rates with health plans. It's not the physician that's really doing this. It's more so like there's like a team of individuals that work in contracting, payer relations, that go and negotiate rates on behalf of the health system. So for instance, here in San Diego, one of the health systems would negotiate a rate with Blue Cross Blue Shield of California for what they call a fee schedule. So here's a list of all the procedures we're performing, and here's the cost that we associate this procedure to be, and then they will negotiate a rate with Blue Cross Blue Shield of California. They will negotiate that same rate with Medicare. They will negotiate that rate with Medi-Cal. They will, with United, with Aetna, with all these different health plans, with Kaiser, and then Medicare along with Medi-Cal would be the lowest, but Medicare is right there and kind of next to it. But for procedure X, United will pay $1,000 to the health system for that. Medicare will pay $800 for that procedure, and Medi-Cal will pay $600 for that procedure. So the doctor is doing the same work, but the amount of money that's received from the for the health, from the payer to the health system varies on the type of insurance that the person carries. So that's what they call a payer mix. Mm-hmm. So and in a financial standpoint, the job of the finance department and the decision support department is to really try and budget and forecast what they anticipate their payer mix to be. So they'll say, we anticipate we're going to do X number of procedures of procedure 1, 2, 3. We also, we just can't say, oh, we expect to receive $1,000 for every procedure. We predict we're going to do 100 of these procedures, at $1,000, this is the amount of money that we're going to get. You have to incorporate what they call the payer mix, which is we anticipate 30% of our population to be on Medicare. We anticipate 45% to be on Medi-Cal. We anticipate this to be commercial, and commercial being the Blue Cross Blue Shields, the Uniteds, everyone that's paying for health insurance. That's your payer mix. And so based on what you anticipate your population, depending on your location, so that's all really determined on the socioeconomic makeup of where you live. So if you live in a city of a certain income threshold, that city's going to have a higher payer mix or higher mix of Medicare and Medi-Cal and a lower mix of commercial. Whereas if you go to like Laguna Beach or Malibu, it's going to almost be entirely commercial with little to no Medicare and Medi-Cal. So It really all depends on your payer mix.
And this is important, not only in getting paid. So hospitals have to get paid, and this is really important, obviously, because it feeds everything. But projecting those numbers will allow for hospitals to understand the revenue, and once they understand the revenue, they can think about, okay, like, well, what can we buy to improve the hospital? How can we improve outcomes? How can we do that? So exactly. the importance of literally one thing determines a lot. So literally the conversation between hospitals and then billing, so Medicare, Blue Shield, everybody, determining how much they get paid back for a service, like a surgery or anything, will determine, okay, like, well, this year we're going to be able to get a new MRI machine, or next year, we're going to not be able to do this because, we may not get these many people, or and so on and so forth. And so my next question was, because Medicare and Medi-Cal tend to reimburse less, is it more incentivized for companies to not accept Medicare and Medi-Cal?
And that's where the limitation comes into play when you talk about what's the downside to having Medicare, is that there are a lot of entities that just will not accept, like the number of providers that will accept Medicare and Medi-Cal is a lot less than the ones that'll accept commercial. So that top tier doctor, the one that's top in the world at his field of study, doesn't accept Medicare and Medi-Cal. You're kind of relegated to a lower rung or a lower tier of care. And that is a downside. I mean, it's a real downside that everyone's aware of. And, you have to do, there's a lot of screening that gets involved on, that's why everyone kind of asks for your insurance card up front with a lot of these things. But it's a real problem, and it's a real issue that, all this stuff gets negotiated higher than my pay grade. But yeah, I mean, that's the biggest limitation, is your access to care.